This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, in case you haven't heard, we're going to have a major heat wave this week here in the area. And Dr. Molly's message is stay hydrated.
You bet.
Interesting that's what we talk about here on the show. Huh? We tie it all together. Heat wave prevention here on Health Watch.
You bet, John.
Good morning and welcome to the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. I'm your host, John Damazzi, as the man said, and Dr. Molly Fantasia is here. Dr. Molly is the Executive Director, the founder, and the PhD doctor for Innovative Medical Associates located in Marlton, New Jersey. And today on the show, as we always do, it's the who, what, when, where, why, and how of Innovative Medical Associates. And as always, if you have questions or if you have a medical challenge that you want to run by Dr. Molly, 855-839-1210 is the number. 855-839-1210 is our number here in the studio. And as always, Dr. Molly will be happy to discuss your medical challenge with you, so feel free to call in at 855-839-1210. And no matter what the weather, Dr. Molly, it's a good day to stay hydrated. But you want to do that all the time, right?
You do. And you want to make sure your electrolytes are good. And, same old. Many people, believe it or not, John, this heat is taking a toll on a lot of people who I would say are our age and maybe a little older. You really got to stay hydrated, folks, and I mean it. And you know how I am about my patients. I tell them, and make sure you wear sunscreen, please.
Guess what I'm wearing today?
Yeah, I am too.
Dr. Molly's sunblock.
Yeah, that's good, John. That's good because we don't need any other cancers developing between us, okay?
That's right. And speaking of age, you have a couple of regular patients. I talked to one of them this week. They're in their 90s.
I know that. Actually, both of them are doing very well. In fact, one of my 90-year-old patients told me, Dr. Molly, do you think we could go to every other week instead of every week now that I did the first 5? I said, it sounds right to me, Mary. I think that's good. She's a yoga instructor, by the way.
Yeah, I met her.
Okay?
Yes.
She's a yoga instructor, and I said that would be fine. And I have another woman who's in her 90s, as you know. She said to me she hasn't felt this good since she was 70. I thought that
listen.
Hey, I thought that was pretty good.
Yeah. Speaking of and feeling good and all of that, explain for those who may not know, and a lot of people still don't know exactly what you do. What is Innovative Medical all about, and what do you do to help the people that you've been talking about?
Well, what we are is, I like to call us we work out of a primary care facility, which is my facility. We are a group of cooperative healthcare providers who can do anything you can normally do in a primary care setting. So if you need a prescription for your blood pressure, you need an antibiotic, an antiviral, we can give it to you. But our philosophy is what separates us from other primary care folks, in that we believe we'd like to use the least amount of pharmaceutical to do the job, keep you safe, effectuate the change you need to keep healthy, and to maintain a quality of life. So we do that by the utilization of hydration. That's one of the modalities that we use. We have a hydration, and that is able to deliver the natural substance to sometimes augment the pharmaceuticals or possibly get you off of them.
Many people ask you, especially when they're in the clinic and they're getting their hydration,
sure,
they ask you, well, what's in my bag?
Where do I start?
Exactly. And somebody asked me that. They said, well, what do you get in your bag? I said, I'm sure it's a variety of things. A lot of vitamin C, but
well, sure.
What is it generally?
Vitamin C can be in many of them, not all of them. Remember, I spoke about that. If a patient has a particular problem with utilization of vitamin C, and I can tell that by doing the blood work, we wouldn't put vitamin C in the bag. But every patient is different, John, and every patient comes to me with a different challenge. So we like to individualize the patients depending on their needs, but we use natural products to do that through the hydration. The hydration is just a vehicle to deliver a therapeutic dose of the natural product.
And again, in the hydration, it could be vitamin C.
It could be aminos. It could be many. It could be a peptide. It could be aminos. It could be many things. So it really depends on what it is we're trying to do and what the physicians and the healthcare providers are trying to effectuate in terms of the change. And I also have a vested interest in making our patients' quality of life. Our whole practice actually looks at the quality of life issues for most people, because in the end, that functionality is what counts, and that goes through all the chronic conditions. That's really what separates us.
And many times I know that you've talked about patients, and I've met them, where they were diagnosed by their doctors.
Now, of course.
Oh, you got 6 months, you got 3 months, you got a year, whatever. And the next thing you know, they come to see you and they're there 7 years.
Right. But how about they're diagnosed by their physician and have a lifetime of misery? There's the key. In other words, it's quality of life. So you have chronic fatigue, you have fibromyalgia. You have to learn to live with some of those conditions. But they all have a common denominator, and that's usually inflammation. And what do? We want to put the fire out in the body so that you can have a quality of life, whatever that is for yourself. In other words, for some people, it's sailing on their boat. Other people, it's golf. Other people just want to sit down and watch Fox. And other people want to, listen to you. And right?
Okay.
And people, it depends on what my patient wants and how can I get them there. That's really the key, John.
Food sources are used as well?
Food sources are generally all I use.
Okay, and what can you give us like an
Sure,
idea? What types?
I can extract vitamin C from rose hips, from tapioca, depending on what I'm doing. I try to use as little synthetic vitamin as I possibly can. We know that certain proteins and certain amino acids are gotten from egg sources. I have to be careful with that if someone has an allergy for eggs. I mean, these are all the things I have to take into consideration before I do it.
You mentioned earlier about some of the 90-year-old patients coming once a week or then every other
Sure.
week and that kind of thing. How does it generally work? I mean, I'm a twice-a-weeker, and I've been.
Well,
you told me I pretty much better stay there.
Well, you and I have a couple conditions
Exactly.
we got to deal with, right?
Right.
So it depends on what kind of condition you are when you come in. Now, that doesn't mean, John, you've gone on vacation, but
Absolutely.
you felt it when you got back.
I always do,
it's
yes.
always a question of whether we can help a patient maintain their reserve. Maintain the reserve that's keeping you sort of in homeostasis, which is the body balance.
All right. The other thing I wanted to mention, the question always comes up about how many times do I come in?
Sure.
Do I come in 10 times, 15 times, 20 times?
Here's the
what
thing.
is it generally?
As you know, I like to say it's not holy water. So one time dip in the baptismal fount isn't going to do it. So really, we like to tell a patient we'd like them to do a series, and then we are going to arrange that series depending on what it is I want to accomplish with the patient and where they are in their continuum of care for their particular condition. So it could be once a week, it could be twice a week, it could be once every other week. But there is a continuum of care. We need to get enough in to maintain the therapeutic level, John. That's the key. And let me tell you, when you come in to me and you have stage 4 cancer, okay, stage 4 cancer, you've been beaten up by the traditional treatments, you want to do some more traditional treatments, but you don't feel you have the get up and go to get through it, well, you may need to come in 3 times a week for what I need to give you in order for you to maintain your quality of life.
So I guess the answer is it depends.
Right. And we'll talk about it. And again, I don't hold anybody hostage. You know that. I say, listen, you're going to tell me, and just what you do. You came back from a vacation. You said, I really needed you. In fact, we put you in an extra day.
Yes.
So that's what happens.
Absolutely. Coming up on our first break of the morning, our program is called Health Watch, and you'll find us here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates in Marlton, New Jersey. Many more things to discuss here on the show. And, of course, your questions, your medical challenge, you want to run by Dr. Molly, 855-839-1210 is the number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return more Health Watch after these words. Back here on Health Watch, operators standing by right now, as they are on every show at Innovative Medical Associates. And what you do is call them right now, 856-489-0505, 856-489-0505. That's the number. And what you want to do is get more information if you like, but most importantly, if you have a particular situation you want to discuss with Dr. Molly, the initial consultation is complimentary. So what you do is call that number and schedule it, 856-489-0505. And, of course, that number is good now and after the show, and it's good during the week, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And again, our program is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. And our number here right now, if you want to talk to Dr. Molly, 855-839-1210. I know you do a lot now, Dr. Molly, of regenerative medicine.
We are.
And you want to talk about peptides in as part of this whole process.
Well, I want to talk about peptides in general because I think people are surprised when they hear some of the common peptides, and you just don't know it. You get bombarded with it, of course, with all the skincare product. You definitely do. So, for example, collagen is a peptide. Most people didn't know that. More importantly, glucosamine, from my perspective, because of the joint pains and things, glucosamine is a peptide. So peptides are really building blocks of protein. And the peptides, what they are is they're shorter chain amino acids. You've heard me speak about amino acids in the bottle. Well, peptides are shorter chains of these amino acids. And what they do is they actually help communication between certain things like hormones, cells, this kind of thing. So you can be sure that they're effective for patients who have inflammation. That's one of the reasons why we use them. So it can help reduce the inflammation. So obviously, if people know that you can go out and buy chondroitin, right, and glucosamine, then I use something very similar. Okay, they also can promote healthy hair and skin. You know about that because every time we turn around, a new celebrity has a collagen product, right? Did you know there's a brand new weight loss drug out right now, a drug that the FDA approved that is a peptide, and it's an injectable. Now, I got to tell folks, there's been a big bugaboo on peptides using them injectable from the FDA, but Big Pharma managed to get one approved for a weight loss drug. It actually was as a result of using it for a diabetes med. So, and by the way, it's very expensive, of course. So muscle growth, it helps with muscle growth. And it really helps enhance your moods. It can reduce muscle soreness after a workout. And all my guys who go to the gym know everything there is to know about peptide therapy, John. They can teach me.
That's right.
Okay, and I love talking to them about it. But I also have used it to help fight off infection. And it's also, of course, used generally for things like asthma, osteoporosis, and, of course, even in cancer treatments, both traditionally and through the integrative group.
All right, we're going to pick that up in a moment, but we have a call, so we're going to go to the phones. Ken is in Washington Township. Ken, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Ken.
Hi there. Thank you very much. I recently got a diagnosis of a calcium buildup in my heart, certain blocks
calcium
it,
build
but I
up
guess they associate it.
in your arteries, right, Ken? Is that what you're saying? I'm having a hard time hearing you. Calcium build up in your arteries, sir?
I had a CAT scan done, and the
Oh,
picture
good.
of my heart showed
Yes.
various, I guess they're arteries, but of the heart, where it
Yes.
showed buildup. And I was
Yeah, calcium
curious,
scoring. Great. That's a good
chelation,
test. Yes.
Pardon me. The chelation process, I understand, would bond with the calcium as the metals work.
Yes.
I'm just curious, do you need to do a full treatment, or do you get can you see progress along the way of that treatment over?
I'll tell you what, you can see progress along the way. It all depends on, it would be very interesting to see your calcium score. That's what you had done, right? A calcium score?
Right.
No. Okay, great. It would be very interesting to see a starting point of the calcium scoring. Now, remember, the interesting thing about the calcium scoring, it picks up scoring. It can pick up calcium outside the heart, not just in the arteries. So there's an interesting, that's a little known fact. But I can tell you that chelation can definitely work. And I would tell you that in our facility, it's not just the chelation that we're looking at. We can certainly remove it, and generally my patients start to see some changes around 20 treatments. But we also then look at cardiac nutrition, which is a little different. So we want to improve the blood flow by removing the calcium, but we also want to improve the heart muscle. So in our facility, our chelation, when we use the term chelation, we're actually using it in relationship to our cardiac protocol, in particular for people who do have calcification in the arteries. So the answer is you do need more than 1 or 2 or 3 treatments, but you should be able to start to see things in about 20 treatments. I hope that answers the question, Ken. Yeah, by the way, it was a great question. Thank you. Thank you for it.
All right, Ken, thanks a lot for the call, and good luck with that.
Yeah, that's an
You
interesting...
know, we often talk about this, that you cut your teeth on heart issues, and I mean, I remember... And I still remember this patient. Your old office, there was a little walk from the parking lot to your office, and he couldn't navigate that. They had to wheel him in.
Yes.
And then he got the chelation. I don't remember how many treatments.
Like 40 or 50 treatments.
And then he was walking in like anybody else.
Yeah, he was. And he lived to quite a ripe old age as well. He outlived most of the people in his family. So, yeah, there's a good testament to chelation and the good that chelation can do. And again, it's the kind of thing, though, I think it's important to realize that chelation is a process. It can't be, it just doesn't work quickly because it's an ionic exchange, which means it takes time. Plus, we want to use it judiciously because we want the patient's kidney functions to maintain. And unfortunately, or fortunately, I guess, when this chelating, it doesn't break the plaque off. It doesn't break the calcium off so that you run the risk of clots. There's actually an exchange. It's more like, I guess, a liquid plumber type thing where it really works and you want to excrete the actual ionic exchange through the kidney screen.
You're talking about liquid plumber. I use that all the time. You know how the bathtub clogs up because of
I know. It's technically not quite like that, but it works.
It does work.
It works.
Right.
It works. So, yeah. So that was an interesting thing. But I want to also point out that in our facility, we don't just use chelation. Again, I'm going to tell you, we're going to use things like cardiac sugars, amino acids, possibly amino acids that have peptide chains. We're going to use things that are going to improve the heart function all over.
All right, we were talking right before the call.
Sure.
We were talking about peptides and regenerative medicine. And can you explain for those who may not know what exactly is a peptide?
Well, a peptide is a building block of protein, and what it is it's smaller chain proteins. So you take a peptide that has a long chain, an amino acid. Let's take an amino acid like taurine or an amino acid like arginine. Well, it can be made up of certain peptides, and it's the peptides that actually have a communication response with the cells or the systems. It can also work on hormones. So it really is an important piece. So peptides can be a little hard to understand, but let us look at what the benefits are. They're natural to the body. The body has all these peptides going on all the time. And again, they do things like they can help quality of sleep. They can help chronic pain. These are peptides that are going on. Glucose control, which is what brings me back to the weight loss drug that Big Pharma just patented, right? And is putting out. So it can reduce injury. It can promote healing. And let me talk about using it in regenerative medicine. So the use of peptides have become more common in larger orthopedic groups that are using certain things like MSC cells, those kinds of things. They're using peptides to increase the abilities of these MSCs to communicate to the areas they need. Peptide therapy can help us also really reduce all kinds of inflammation, and I'm talking about inflammation for people who have chronic inflammation issues, whether that's Alzheimer's. There are many studies now that are showing that these peptides can actually stimulate muscles and blood flow to muscles and to various parts of the body.
You know, you talked about many health benefits as far as peptides are concerned, and you do use it in regenerative medicine.
Right.
Do you use it in other things?
Yes.
Okay.
Yes, because, again, look at the ones I mentioned to you. Glucosamine. Wouldn't I use that in an inflammatory process if somebody's coming in with joint pain?
Yes.
Right. Collagen. Wouldn't I want to use collagen? By the way, glucosamine with collagen does a heck of a job in terms of actually lubricating the joints, especially small joints. You
mentioned about collagen and a lot of the movie stars.
Oh, yes.
With their skincare
it's all
line.
skincare line, right? I mean, it's unreal.
Is
right?
Is it in your
skincare
line?
Yes, we have it in our line too. But again, my sources were natural source. So peptides can be made up synthetically, and I think that's what really caused the big problem with the FDA. However, they had no problem approving the weight loss drug. So I just want to point that out to everybody who's listening, because it's another indication of how good God's made our body. And the natural peptides are in the body right now.
What do you think? You and I go on TV to push your skincare line? If Cindy Crawford can do it.
No.
I can't.
Yeah, topical use of peptides have been around, but no, I don't think so, John.
Right.
Thank you.
It was a thought, all right?
Yeah.
We are coming up on the halfway point of our show. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. We're going to talk to Charlie in the Northeast after the break, and maybe we'll talk to you as well at 855-839-1210, 855-839-1210. Our program is Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More of today's version of Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates. And as always, you can contact them during the course of the show or after the show. They don't go home at 9 o'clock like we do. Pretty simple. 856-489-0505 is the number. 856-489-0505. That's the number, Innovative Medical Associates, Marlton, New Jersey. You call that number, you get more information, and most importantly, you want to make an appointment to sit down with Dr. Molly, as she meets with a lot of folks during the course of the week who listen to the program, and you can certainly be one of those. Call up and schedule that appointment, 856-489-0505, and don't forget, you can get a lot of information on the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. And again, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. We're going to go to the phones. We're going to talk to Charlie in the Northeast. Charlie, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Charlie.
How are you doing, Dr. Molly?
Good.
A couple of questions. The one, you're talking about chelation. Is it safe to take activated charcoal, and what does it do? Does that clean your blood or take your acid out of your blood? Or
people do use activated charcoal, and actually, it's interesting. Traditionally, we used charcoal in traditional laboratory when someone was having poisoning, that kind of thing. They actually ingested the charcoal. So we know that it does have an effect in terms of utilizing that and getting out some of the toxins. But, will it work removing the calcium from the plaquing? I don't think so, but that's a good question. I would say, thinking about this from the scientific point of view, I don't think so. I think that the EDTA is certainly more efficient in that regard. Is chelation safe? Certainly it's safe, but I'm going to say that with certain parameters. Obviously, I would want to check, or I think anyone who does chelation would want to check your kidney functions. I would want to make sure that they're up to par because, as I said before, it comes through the ion exchange. The fluid's going to come through your kidneys. That would be the one thing. I would want to make sure that the other ingredients that we would use in the chelating portion you're not allergic to in any way. And I would want to make sure that we do it with quality product. That happens to be the EDTA is a man-made amino acid. It's probably one of the few things that I actually have compounded that is man-made or synthetic in our entire clinic. But I'm very fussy about the quality of the EDTA. And there are two types of EDTA as well. Go ahead. Anything else, Charles?
I have another question.
Go ahead.
I keep hearing recently, within the past few years, the tomatoes are bad for arthritis and this, that, and the other. And I have problems with my feet, arthritis in my feet. And I always grew my own tomatoes and would eat 5 tomatoes a day in the summer with salt or on bread with cheese. I love tomatoes.
I understand.
I don't know if I can eat them anymore. I try, I still have to eat some. I mean, I love tomatoes, raw tomatoes.
Right. Well, listen, you'll hear me say I'm not the food police, but it seems to me that you love your homegrown tomatoes, and I don't blame you. It's like Jersey tomatoes. We know there's a big difference, right on you. But here's the deal. Nightshades, yes, there's a lot of data that says certain things like tomatoes, eggplant, stuff. Listen, John, I don't know if you're Italian, but trust me, John and I have a problem with all of this.
That's right.
You know what I mean?
The nightshade family includes green peppers and red peppers,
right.
and potatoes too. So
that's right. That's right. And no, you get to a point where you say to yourself, forget about an Italian buffet, right? You got to move out of the way. You
can't eat the pasta. That's gluten,
right. So, the idea is, I think it's an interesting thing. I think there are a lot of things that could help what's going on in your feet. The other thing is, you don't happen to have a uric acid problem, do you? Like gout, that kind of thing?
Yeah.
Gouty arthritis, There's several things that I would put in the bag that could help you, and therefore allow you to eat some of the nightshades, some of the tomatoes. But of course, in the beginning of therapy, you really need to lay off of it at least for the first 2 weeks, and then gradually.
Good. Which helped really a lot.
Good.
And when I went on Medicare, it was too expensive, so they stopped giving it to me.
I'm sorry.
I'm taking colchicine, but I can't eat hardly any red meat, and certainly no sausage and bacon and stuff like that.
I understand that. But listen, there are a lot of natural products that may be able to augment that so that you won't have to use as much the conventional stuff. Call my office. Come down. It sounds like you're on Medicare. Come on in for the free consult. I'd love to help you. Okay?
All right, Charlie.
God bless you, Charlie.
Thanks a lot for the call. Good luck with everything.
That's a nice call because he's right. Once he went on Medicare, he couldn't afford some of the drugs that were helping him with his gout and with his gouty arthritis. And, that's one of the things my patients will tell you, John. We're able to help cut some of those costs. Now, you would say, well, you're not cheap, Dr. Molly. I've heard that too, right? But bottom line is your health shouldn't cost you the house to take care of your health with natural products. But you do need the hydration to get enough of that in. That's the thing.
It reminds me that he was talking about those Jersey tomatoes, the big tomatoes.
Yeah, sure.
That's what I got. 2 of them sitting in my house waiting for me to eat them, and that's what I do.
Of course.
One sitting at a time. I'll eat a whole tomato.
Well, you're not alone, John, and if you know enough about my clinic to know that we have people who enjoy quality of life.
That's right.
Quality
that's
of life. But, this goes back to what we talk about all the time, which is inflammation. Now, inflammation is an acute challenge, right? And in the conventional world, John, it's treated by the doctor with the help from the patient. But I had a mentor who told me chronic disease, as treated from a functional medicine point of view, is treated by the patient with the help from the healthcare provider. In other words, what we do is we sit down with you. It's not just the hydration, but we're going to have Nurse Barbara sit down and give you a diet, also an anti-inflammatory diet. We're also going to talk about what types of oral anti-inflammatories you can use and what other types, maybe lotions, things like that we may have compounded for you that can also help you get through whatever the challenge is.
And you mentioned to me a couple of weeks ago, you said, I didn't like your numbers.
Yes.
And you suggested this particular natural substance for kidneys.
Right. That's right.
And you don't carry many things, but
no,
you
but
carry this.
No, but that's one I do because I love the. Here's the thing. People poo-poo natural products, but if natural products have really good data associated with them, there's no reason not to use it. And the more people would look, and I really mean that, go past Dr. Google, folks, go into things like PubMed, you will see that there are a lot of quantitative studies as well as qualitative studies that tell you what type of natural products can effectuate what kinds of changes.
All right, we wanted to talk about, we're coming up on another break, but before we do that, we wanted to talk about a patient, and you've talked about this before.
Eileen.
Yeah, the regenerative patient. She had breast implants?
She had breast implants, and let me tell you, she came into me. She was a friend of the airline pilot that we helped mend his ALS. But in this case, she really was a mess. She was loaded with inflammation. Her body was on fire. She came into me about 4 or 5 weeks ago. And she really listened. She brought her sister in. Her sister was a lovely woman, very interested in natural health, natural medicine. And we actually put her on a program. And just this past week, she told me she cannot believe how much better she feels. And it's really been a series of hydrations that have done this, along with certain things in terms of the regenerative cells that we've been using for her. That has really made the difference and has put the fire out for her. But I am talking about global inflammation. Now, there was no data ever put out about those implants. You know that, John.
Right,
back
I know
in the
that,
day.
yeah. There was a lot of problems.
A big time. And
after that, yeah,
right,
many times.
Right, and women were suffering from this, and lots of conventionalists was telling them it's within their heads. But you know what? You can't possibly have as many people as they were who were having trouble with these. And by the way, her implants didn't leak. First thing you got to do is get them out, and she did. And she did. And I will tell you, she told me herself, she said she has never felt better in the last 6 years than when she came over to us.
Quality of life, you've often said that.
Quality of life, my friend.
Okay, coming up on our final break of the morning, it is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We have some time left here on the show, which means if you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210 is our number here, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We both return after these words. Hi, it's John DeMasi, host of Health Watch, Sunday mornings at 8 and again at 4 here on Talk Radio 1210. Have you or someone you know been diagnosed with cancer or breast cancer? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates can help. They offer medical hydration therapy. Their cancer support program is designed to reduce chronic symptoms often associated with diagnosis or treatment. including pain and fatigue. Dr. Molly's unique protocols have improved quality of life for hundreds of patients.
I want to help you heal. I want to help you have a quality of life while going through cancer treatments.
Visit innovativemedicalassociates.com to learn more about their cancer support treatments. Join me and Dr. Molly when we discuss the benefits of medical hydration and more on Health Watch every Sunday morning 8 till 9 and Sunday afternoon 4 till 5 here on Talk Radio 1210. Back here on Health Watch, operators again are standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock this morning. 856-489-0505 is the number. 856-489-0505. Call them up, schedule an appointment to sit down with Dr. Molly. As I said, I go in twice a week, and every time I go in, Dr. Molly's in a consult with somebody from the radio, which is nice, okay? 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Don't forget, if you miss any of today's show, we have our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. Let's go to the phones. Let's talk to Jack in Marlton, New Jersey. Jack, good morning.
Hey, Jack.
Welcome to Health Watch. You're on with Dr. Molly.
Hey, Jack.
Good morning,
Hello?
Dr. Molly. And I have a mystery that no one has been able to answer yet. Possibly you will. I have only given blood twice in my life, back
Okay.
in 1974 and 1975.
Okay.
And the first time I gave, I was anticipating, feeling, really, really bad after giving. I sat down after the first donation, jelly beans and stuff like that.
Sure.
And then the second time was a year later, and the same thing. But anyway, what happened after the first time and after the second time was, instead of feeling that way, for 3 days the first time, I felt absolutely bionic. I mean, absolutely bionic. That's the best way I can describe it. And after 3 days, I went back to my, same kind of lethargic stuff. And then the following year, the same thing.
Jack, let me ask you a question. Do you have have you been diagnosed with any kind of problem like hemochromatosis or anything like that?
No, I haven't. I've never been checked for it, but I've never been diagnosed with it.
Okay. I just wanted to know. Okay, so you were giving blood because you wanted to give blood and do the right thing and be a good citizen. That's great. Okay, so you're talking about times at 1975?
74, 75, yeah.
Honey, things have changed, too, since then. I mean, the process, I'm sure, I was in my training in the 70s. I'm sure the process was a little more arduous than it is today. But it is interesting. You almost want to know what else is going on. And maybe what you have to do is maybe nutritionally, you were a little low on maybe some of your protein, some of your sugar. When you ate the candy, you felt a little better. I mean, it could be many things. It could have been many, many things. But it also could have been the technique back in the day. It might have taken too long. Today things are so much quicker. And by the way, it was whole blood you were given, Jack. Just a side note. Was it whole blood, sir? Okay. Well, he's not. Was it whole blood?
What kind of blood?
Was it whole blood you were giving? In other words, it was the red blood cells. Yeah. Okay.
Yes.
It could also be that you were dehydrated. But things like that happen, Jack. I would tell you, I don't know how old you are now, but I wouldn't be giving blood if I were you. Okay. God bless you, my friend.
Jack,
thank you.
Thank you for the call. Thanks
Thank
for the
you.
call. Appreciate it.
He could have been dehydrated. Anything. Go ahead.
Pauline is in Newtown Square. Pauline, good morning.
Hi, Pauline.
You're on Health Watch. You're on with Dr. Molly.
Well, hello, and thank you for taking my call. My daughter has an infection in her left leg in the calf area, and she's had it there for like almost a month, and she was on antibiotics, and it did not do anything. And so they're talking about doing an MRI next week. She lives in New Jersey.
How old is your daughter, dear? How old is she?
She's 59.
Okay. And in the calf area, she has swelling? Does she have swelling there?
Well, She did have swelling originally, but now the swelling is gone. But they feel that it's an encapsulated area there, but they're not sure what's in there. It was not a bite that she can know. So they don't know what it is.
Did they take out any fluid and culture it for her, or you don't?
No, they haven't done anything. They're talking about maybe doing some surgery.
Yeah,
but I told her to wait until she has the MRI to find out what it's really.
Guess what, Pauline? You're very smart. I would have all the radiology done, and the other thing is, has she had a complete blood workup? I mean, they gave her antibiotic. Did she have an infection? Was it an open infection at the time or not?
No, it was not. No.
Wow.
It was just sort of a swelling there and red.
Yeah. You know, that's a very interesting thing. I mean, that could be anything from a skin type of cancer to who knows what. But the point is, it's interesting that they just put her on the antibiotic without any kind of culture, without any kind of radiology. I mean, she needs the radiology done. You are so right. Tell her to get that MRI and the CT, and maybe she can get it together so they can see what's going on. God forbid. God bless you.
Yes. Well, thank you. She just went to urgent care, and that's why they put her on this antibiotic. But it didn't do anything.
Yeah, I call that urgent. I call that urgent no care. Sometimes it's like you know what I mean, right? Because unfortunately today we don't have our primary care docs, right? We're our primary care providers, so they don't know you. Same story, different day. No,
well, Pauline,
I'm going to put her on our prayer list, Pauline. God
Thanks
bless
for the call.
You.
Appreciate
Bye-bye.
it. A couple minutes left of the show, and I know you wanted to talk about this post-COVID patient.
Yes.
Tim,
yes.
And you notice you and I talked before the show. You notice COVID back in the news now?
COVID, enough to scare everybody half to death, make sure everybody's on some kind of anti-anxieties. But you know what's interesting? So Tim definitely had COVID. He came into our facility, and I knew he needed to be hospitalized immediately, sent him. But he has been my patient since he's been discharged, coming in faithfully, at least once a week, faithfully, and getting our post-COVID. He went for his CT scan, and you won't believe this, but he has great improvement. Now, what is interesting about this is he still has the ground glass shadow that is COVID related. And he tends to, when he's doing his exercise or working out, he can't do as much as he did before. I had my nurses put a stethoscope on him this week, and she said to me before the CT, Catherine said, Dr. Molly, I think his lungs have some improvement. He's moving air. Well, I'll be darned. He is. The radiologist called and said, wow, there's improvement here. And he goes, that's unheard of in this time period. I said, well, God bless you, doc, but my doctor is super. And that's what we said. So we know what we're doing. And I'm telling anybody who has a post-COVID syndrome, please call me. Come in. There are many systems that are affected, including for men, their hormones, testosterone drops post-COVID. So I think Tim can't go back to the heavy construction job he was doing, but nonetheless, he's still going to be living a high-quality life because he's expecting his first grandchild.
It'll be a decent quality of life, like you said.
You better believe it. He walks around, he drives around, he's doing okay. God bless him.
And with that, we put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates at 856-489-0505, 856-489-0505. And don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Don't forget our replay this afternoon, 4 until 5. If you missed any of the show or you want to hear it again in its entirety, 4 to 5 this afternoon, Health Watch replay here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nurses, Barbara, Catherine, Jess, and since I forgot her last week, I got to say her twice, Lana, okay? Joanne, delightful Dee, fabulous Fran, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thanks for listening. Have a great week, and we'll do it all over again next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.